call it physical disease, or whatever else you can call it. It's not relevant to the addiction. You know what addiction is, or dependency is, but you don't have one. No one has to tell you what that is. No one has to tell you what you're up against when you have to try to deal with it. If we talk about drug addicts, though, in terms of what can be done or what needs to be done, from what we've said so far, at least two things become apparent. One is a drug addict will never cease her dependency on drugs until we can at least transfer it onto people. You have to start there. Meaning that a sense of trust, which means vulnerability. You see, most drug addicts are frightened of loving. Many of us are frightened of loving. We may need people, but loving is an entirely different matter. Loving means that we're vulnerable. Because when you love somebody, you really give them your whole being. You give all of yourself to somebody. And that makes you very vulnerable to pain. Can you see what's the danger? Why are you vulnerable? What's the risk when you love somebody?
Rejection.
Right. And what's the danger of that? What's the consequence of being rejected? Where's the pain come from?
Feelings of worthlessness.
Yeah. It isn't just the rejection, you see. It's how we interpret the rejection to mean I'm nothing to this person, I'm worthless to this person, therefore I'm worthless. And if I'm worthless, then I'm nothing. And there's the pain of being nothing. So until a drug addict can learn to love, I don't mean just get involved in a relationship, in a needful relationship, because quite often they don't risk in those relationships. They just take. And therefore there's no real risk. That isn't substantial enough to really change the drug addiction. Until they're able to really love and generate their own natural high, until they're able to really risk, which means putting the whole thing on the line, being rejected and being worthless, until they can resort to relationships with people as a means of getting a sense of worth, really relying on people, trusting people, that they can give them a sense of worth, value, and security, because they both go together. Because if you love me and I'm ill, you'll come take care of me because you value me. And to lose me would be a very great pain to you. You see? So I get both a sense of worth and a sense of protection by being loved. But if I'm convinced that I'm unlovable, really convinced that I'm unlovable, you see, there's no way I'll turn to people. What else have I got left except drugs? There's an immediate high. There's an immediate sense of well-being. So we have a very difficult issue. To get people who are extremely mistrustful, who as a way of life have learned not to trust people, except to use people manipulatively, exploitatively, whatever they can get them to be able to risk, to be able to love, to be able to give themselves totally, is no small matter. And therefore, whatever remedies we come up with in this institution, any other institution, it's just dabbling. It doesn't get to the core of the problem. It looks good on paper because we're trying this and we're trying that and so forth. But it's all dabbling because it doesn't get to the issue. That's one essential part of it, which is a real transformation in their lives. They become a different person. From an extreme egotistical person, totally self-centered, of necessity, because who's going to protect me if I don't protect myself? Because no one ever has wanted to protect me, to take care of me. So number one has to come first. When they're able to really love and trust, is a tremendous change in their whole life. And the other aspect, obviously, is the capacity to endure pain. Physical pain and mental pain. And for some of them, I mean, even working is a painful thing. Because very frustrating. Any frustration is pain. When you want something and you can't get it, it's painful. So they have got to learn gradually to endure frustration, to endure pain, if it isn't dished out in a punitive way. Because without the capacity to withstand pain and frustration, they haven't really changed. Because as soon as they go out and they are frustrated, the pain is very great, and right away to the drug. That's the only sure bet. That's the only sure thing you can rely on to make sure that you don't have pain. So unless the capacity to endure pain is enhanced, nothing has really changed. And if you don't do that, if you haven't enhanced their capacity to tolerate pain, tolerate frustration, you haven't enhanced their capacity to really live more unselfishly and lovingly, you haven't really done anything to alter the problem of the drug addiction. I don't care what you do on the surface, no matter how good it looks, because drug addicts will conform to anything to manipulate you into whatever they want. They'll give you whatever results you're looking for. But when they're on their own, it'll still be the same. 5 days after they leave here, and what they tell you will still be the drug. That's the only friend. That's the only true friend you can depend on for a high, for a well-being. And it's quite likely that this institution, like most institutions, are not set up to really be remedial for drug addiction problems. Because we're so structured that we're not in a position to establish love relationships with these girls. And we're not in a position quite often to frustrate them and encourage them to face pain. And, although we are in the position, I think, to give them work details, encourage them to persist in their work and endure the frustration of the tension that builds up by saying, well, I've done enough work for today, I want to go play for a while, I want to go avoid, because they're chronic avoiders. Their whole life is one of escape. At least a little bit of pain comes. And I've seen this even in many marriages. I'll do a lot of marriage counseling, and husband and wife might be a drug addict, but they still are the same in the sense that they can't endure pain. So as soon as there's a conflict, the husband disagrees with the wife, and they start yelling and so forth. She immediately stops and says, I will not fight. And either he walks out the door, or she walks out the door, or she turns her back and walks away, or she starts to cry, which makes it impossible to communicate anymore. It's the same problem. One or both is saying, I can't stand pain, and conflict is pain. Therefore, anytime you raise your voice to me, I've got to run. Too much pain. The problem also being, if I have an argument with you and I fight with you, you'll stop loving me. If you stop loving me, you'll reject me. If you reject me, I'll be worthless. More than that, maybe you'll abandon me and I'll be all by myself. I can't take the chance with that. I can't face that pain. So one tends to surrender to the other, or one keeps the conflict inside and never verbalizes it. And of course the relationship deteriorates over time, so there's no emotional intimacy at all anymore, because they can't share what they're feeling, because they've got to run from the conflict. I raise the issue only to show you that it is not just in the drug culture that there is a tendency on the part of people to run from pain. This whole society really has subtly conditioned you to be intolerant of pain. They always tell you that drugs available if you have a headache, if you have a toothache, or whatever it may be. The ad is always saying, why endure pain? You don't have to endure pain. And psychologically speaking, there are always tranquilizers and alcohol, and society has to give you these available. No matter how much they yell and scream about alcohol and drugs, society will always make it available, of one form or another. Why? Because obviously if you didn't have a crutch to lean on, to escape from your anxieties and pain, you'd start asking some very embarrassing questions, such as, why am I so nervous in the first place? Then you might realize that in terms of what society is doing to you, that it's creating the competition and the insecurity and the comparisons that's making you so terribly insecure. So those will always be available, and that'll shut you up for a while, and you'll never ask any questions, because as long as you have your drugs, as long as they become legalized, or you have your alcohol, or you have your pills, you don't ask ever, what's making you so nervous? We assume that it's a given. Everybody's nervous. Everybody has their cigarettes and their coffee and their TV and their sexual affairs, or whatever one uses to escape from the pain. We never ask why. So within a society that encourages escape from pain, we have to do something to discourage the escape from pain in order to really help the drug addict, which is no small task. My interest was in demonstrating to you, if I can, that you're not that terribly separate, that you're coming to these classes to learn about drug addiction, see, which is a kind of nonsensical thing, because all you have to do is to ask yourself about your own addictions if you really want to understand addiction and dependency. All you're going to learn is information and theories and so forth, which have no bearing at all on your addictions or on the girl's problems, because the girls are not theories, and you can't apply those theories. You can only apply what you do for yourself. So with that as a kind of frame of reference, if you want to ask any questions, I'd be glad to respond in any way I can. If you want to be angry with me, it's okay too. If I've said something naughty.
In talking that people feel like they're not wanting and they're alone. And yet, some of these girls that are on drugs, their parents do care for them very much. Maybe they're not communicating, but they do care.
Well, sometimes that's true. Quite often it is not. Actually, quite often they really do care more about their reputation. The girls become very sensitive to that. Yeah. That the girls have become very much aware. The parents say, I want you to do it because I care about you. But the girls feel that they just want me to be good because they care about what this does to them in the community. And sometimes the caring is in the form of control, where the girls interpret the parents' caring as exerting too much control over them, and therefore they rebel against the control and don't really feel the caring. If the caring is there, a parent who cares listens to the girl. Doesn't wait for the girl to get into drugs and into some other kind of behavioral problem before they wake up and say, hey, there's something wrong. If you care about somebody, you listen. You realize they're unhappy. You talk with them about what's making you so unhappy. There is no caring without listening. And if you listen and you know what's going on inside the girl, you know how to behave. And from that comes real love. So I don't doubt that a lot of parents are attached to their kids, maybe even need their kids. They care because, in a sense, they gave birth to those kids. But the caring is not enough. It isn't the right kind of caring. It isn't involved enough caring. Or, somewhere along the way, the girls have perceived that maybe the parents care too much, maybe about some other child in the family, which by comparison makes them feel uncared about. Or some parents care too much, which makes them feel controlled, and they feel prevented from expressing their own individuality, their own maturity. So I think if real caring is there, which means taking time with the child from early childhood, that the child knows early, which means to care means you don't hold the child close to you. You let the child run when he wants to run. And then every once in a while come back for a little bit of a hug, when he feels he wants security, sit on your lap. And then he'll take off again. And if you're not there when he wants to come back, you've got a problem. Or if you keep him there when he comes, don't let him go when he wants to go, you've got a problem. And that's what security means. Security means letting me go when I have to go, but being there when I have to come back. And then as time goes on, the child has to come back less and less often until they feel strong. But all of us, when we're young, we have to feel there's somebody back there who will pick up the pieces in case we fall apart, in case we get hurt very badly. There's a source of solace at home. So we can go home and we can tell our parents about being frightened of our teachers, or frightened of the bully down the street, or frightened of growing up, or frightened of sex, or frightened of our own angry feelings. And parents won't say, it's all in your own head, forget it. Which shows no listening, you know. Or, I felt the same way when I was a kid, and you'll outgrow it, you know. Or some such insensitive kind of reaction. Kids can't come. They're just coming to be on your lap. They're coming for some sense of understanding and sharing that'll reduce that sense of anxiety and discomfort. And quite often we're not there. We're too busy with our housework and with our career and with other people and so forth and so on. But it's nice to feel that we're good parents, so we tend to forget sometimes. We become insensitive in regard to that. So now we're in the position of trying to make up for what the parents haven't really done by reestablishing a trust with people again. A trust that people won't reject them or at least hurt them, or that people can value them. And not only a sense of trust about their worth, but a sense of security and protection that comes with feeling if anything bad happens to me. We have one girl, who I'm sure most of you know, that whenever she feels people don't care about her, and she becomes convinced about that, well, she just cut herself, because her feeling is, if people care about me and I'm bleeding, they'll come. You see, so if they come running when I'm bleeding, this is a sign of caring. She forces that from everybody. That's the only means of control she's got, to guarantee that people care. Because she can't stand the notion that nobody cares. That's total abandonment. That's total worthlessness. So whenever she's down to that point of feeling totally worthless, totally abandoned, there goes the cut, there goes the blood. People come rushing, what have you done to yourself? There's the caring, and already a sense of worth is reestablished. Now she can go on for a little bit longer. And there are patterns like that of one kind or another with so many of the girls. And we tend to get angry with those people. Why? We feel manipulated, we feel controlled. Why are you forcing me to react to you? Don't you know that I would react to you anyway if you didn't force me and didn't manipulate me and didn't trick me? They can't depend on that. They can't depend on anything. They've got to have a sure thing. And if the drug is not the sure thing, cutting themselves is the sure thing, or hurting themselves in some other way is a sure thing. Because it makes people come running. The biggest fear is if I hurt myself and nobody comes running. And the most damaging thing we can say to them is, if you should ever hurt yourself, nobody's going to come running. See, they're panic. It's a panic they have to be able to face. But that's the panic. Being locked in the room is the same thing. Being locked in the room means, if anything bad happens to me and I yell and scream, nobody's going to come. You see? Nobody's going to come. I'm helpless in the face of pain. I can't be. I'll crash the windows out, I'll kill myself, I'll do something, but I will not sit here and be helpless in the face of pain. For us, it takes a lot to feel pain. A lot of these girls, any bit of tension is pain. Any tension. The buildup of sexual tension, they've got to act it out right away. Anger, tension of anger, got to act it out right away. Hurt feelings, got to cry right away. No tension can be tolerated. Tension is pain. You can't stand any kind of pain. Pain can destroy you. It's very much like a little infant. You know, a little infant is hungry, and it doesn't know mom is going to come with a bottle. And it's crying and screaming after a while, because that little infant feels that pain is going to destroy it. It has no trust. And sometimes for the drug addict, it starts that early, where the infant, physiologically speaking, has no trust that if I'm hungry and I'm in pain, mommy's going to come with a bottle or with a nipple. She don't come. She lets me endure the pain more than I can stand. And so mistrust is built up very early, that you can't rely on people to eliminate the pain. So I think those are the essential problems we're facing. Yeah.
Are you saying in discipline and the relationship hasn't been built strong enough there, that you're saying I can't accept you as you are, so, and I feel powerless, so powerful when we punch you.
You mean when the girl punches you?
Pardon?
You mean when the girl tries to punch you?
No, you're gonna punish, like, let's say something would happen with the girl,
Yeah.
between myself and the girl, and I would feel powerless because she's acting out.
Yes.
So I put her in her room.
Yes.
Is that saying to that girl that I'm not accepting you as you are?
Well,
I can't accept you with your bad and your good, and I can't try to work it out.
Yes.
Because I feel powerless.
Yes.
I feel more powerful by doing something physical.
Yes. First, you must see how you're escaping from yourself. In other words, you're saying, I feel weak and impotent, powerless. I can't accept that feeling, so I'll act in such a way to show that I'm not powerless by being able to do something to you. So the first issue of that is, I will feel powerful by making you feel powerless, by putting you in a position where you are powerless. So the first aspect of the problem is really our own. That doesn't mean that no discipline is necessary, because discipline really means to learn. Discipline always has meant a means of helping people to learn. And when discipline is part of a learning process, discipline is very necessary. It's essential, because a lot of these girls have a lot of learning to do. They have to learn how people react when they act in a certain way. People are going to reject them. People are going to hurt them physically or whatever other way they act in particular ways. So we're never saying that discipline is not appropriate. What we're saying quite often is sometimes we have a short fuse ourselves and we tend to discipline because we feel helpless. Just the thing that they run away from, we run away from, and we use them as a means of making ourselves feel powerful. Because they're the helpless ones. And by making them feel helpless, and they can't do anything about it, whereas we can, coming into this place in the first place feeling very helpless, here we then control them in such a way as to acquaint them with that helplessness, from which they can't run. They came into this place always running from that helplessness, through alcohol, drugs, sex, some other means, or physically running from home, whatever makes them feel helpless. And here we put them in a room where they can't run from the helplessness. So they become smack acquainted with that helplessness. It begins to overwhelm them. They've got to do something. Kick down a door, or break a window, or cut themselves, or do something. Because if you act, you don't feel helpless in the face of pain, because you're doing something. Even means yelling and screaming. The worst thing in the world, you see, is to have your hands tied, and your legs tied, and here's the train coming down the tracks, and you're helpless, and you can't do anything. That's a frightening thing. To be helpless in the face of pain. You must act. And so the girls act. So there's nothing wrong with our disciplining them if the discipline hopefully comes out of love. It comes out of caring, as a way of teaching them something, and not as a way of punishing because they have made us feel helpless. They've made us feel in a way that we can't tolerate in ourselves, and so we make them feel what we know they can't tolerate in themselves. That is not considered to be too good a rehabilitative attitude. But that doesn't mean we must be permissive, because permissiveness is not a constructive thing. Permissiveness means a kind of weakness, where we let them believe they really are all-powerful, which is an escape from their own feelings of helplessness and fearfulness. They are not all-powerful either. Most of us start to recognize that we are all vulnerable, that we have no omnipotent control over our universe, that we can walk across the street tomorrow and get hit by a car and get killed. We are not invulnerable. Some people can't live with that awareness. They've got to pretend they're invulnerable. But hopefully we can deal with our feelings of vulnerability without having to escape from them, without having to feel too vulnerable, and without having to inflict it on others. And that's what we want these girls to learn, how to be naturally vulnerable, realistically vulnerable, because we all are realistically vulnerable. We all get involved in relationships in which we can get hurt. We all take risks all the time with people, with ourselves, physical and psychological risks. Any other questions? Yes.
How do you let a girl know that when you do take a disciplinary action that it means not because you yourself have a personal anger?
Okay. Let's first ask that question of ourselves. How did we know when our parents disciplined us that they disciplined us because they cared rather than because they wanted revenge on us? How did we know? Because quite often we did discipline because we wanted revenge. They first loved it. How do you know they loved you? How did they communicate that when they disciplined you?
Not by saying this hurts me more than it does.
No,
you. That doesn't work.
Because you can all see through that.
Caring enough to be concerned about their welfare, care enough to say, no, you must not do that, and they do it anyway, and it's maybe placing themselves in jeopardy, and you're going to do something about it, and you care enough that they will be happy and healthy instead of being crushed on.
Yes.
You care enough to say no sometimes.
Yes. Sometimes we care enough even to make them unhappy. Like when we give them the old days castor oil, when they were sick or something. Or give them some, when they bruise their knee, we give them some iodine or something. I guess they don't use that anymore. But it used to bring pain. But you did it anyway because you love the child. So it isn't always saying, I'll never bring you any pain. But I will do, out of my love for you, I will do what is absolutely necessary for your well-being. But how do we communicate that caring? You see. We all say the caring must be there and must be communicated. Otherwise, the discipline is not really a learning device. It becomes then a punitive device from which they learn only one thing. Don't trust people, and especially authority figures. They'll screw you every time. That's all they learn from that.
Doesn't it go back to that listening? I mean, it goes back to listening. You can listen.
Yes.
And not just punish without first letting them say how they feel. Tell them why you're using this disciplinary action.
Yes. Yes.
And
make it
communication
commensurate with the crime.
Yes.
Completely unrelated.
Yes, make it realistic. Yes, more than just listening, hearing. Because a lot of us listen, but we never hear. And hearing is saying, I know you felt you had to get angry. I know you felt you had to use curse words because I said something bad that hurt you. It's a way of saying, I know you've got feelings like that, and I grant you the right to have those feelings. I don't always grant you the right to tell me off in curse words. That I don't. See, because that hurts me now. But I understand what you're feeling. And I understand to some degree I put those feelings there. That's giving credence to the fact that the person's a human being and has those feelings and has a right to have those feelings, but doesn't always have a right to use those feelings in the wrong way. See? That's not just listening, that's hearing. Hearing means I hear what goes on in your guts. I hear what feelings you've got. I don't say right away you have no right to be angry. You have no right to cry. You're a big girl now. So we quite often say that.
But in the instance of, the episode of yesterday, it was not the time, it was not appropriate then to talk with this girl, because she wouldn't have heard you.
Yes.
What you said. You had to act.
Yes.
And then talk afterwards.
Yes.
Which was done.
Yes.
But this was the instance where she had to be locked up.
Yes. But still we can do some talking. We can still say, I know you're not going to understand what we're doing and why we're doing it, but we're doing this because we have to try to help you in this particular way. Whether she hears it or not, at some level, she hears it. So though she can't act any differently, at some level she feels these people, at least in their own mind, are doing not just to punish me, make me feel more helpless and vulnerable. They believe they're doing something to help me. But you're right. We know that sometimes the girls don't have the controls and they can't do differently. But we can still show them that we're listening to what's going on within them. We can still say, I know you can't control yourself right now. I know you're very scared right now about what we're doing and about what you have done, but we're going to have to do this anyway. But we'll talk about it when you calm down a little bit. But still we're talking to them. To the most regressed psychotic person, in the state hospital. And you go through the wards of the most regressed wards. There they are standing like this, or whatever, in those rigid poses. And you talk to them and they don't blink an eyelash. You think they don't hear anything. But I've had a number of those persons when they become somewhat healthier. And they would say, Dr. Hammer, when you walk through the ward and you talk with me, I never reacted to you at all, but you know, there was still a part of me that was listening. Still a part of me heard what you were saying, but I was in no position to react to it at all. But yet, what you said had a tremendous effect on me. Even though I never blinked an eyelash, I never related to you, never said anything, you were getting through to me. We can't always assume we're not getting through if we get no reaction. All we can do is to plant the seed. But our objective has got to be that these people